What's going on, everyone? Welcome back to another episode of the Muscle Memoirs podcast. Today, I am joined by Dr. Quinn Hennock from Clinical Athlete. Dr. Hennock, how you doing today?
I'm doing well, Mike. Thanks for having me.
Yeah, it's absolutely my pleasure. So, to give everyone a little background about the topics we're going to get into, we're going to be touching on some of the common quote unquote dysfunctions or adaptations we see when it comes to common powerlifting and bodybuilding style training. So, to jump right into things, when it comes to some of these common dysfunctions that I personally see, or I think that most people will think of when they hear this topic, is limited overhead mobility, anterior pelvic tilt, especially when it comes to, well, excessive anterior pelvic tilt, especially when it comes to things like hip hinge exercises and barbell back squats. Dr. Hennock, are there any other things that come to mind when you're seeing these sorts of patients, common limitations that they present?
Well, I think there's actually a lot to unpack in that regard too. So I'm going to be the worst podcast guest ever and actually throw a question back at you. When we say so lack of overhead range of motion, is that a question of is it actually a problem, or are we assuming that that has been established as a problem for this particular population?
So I would say let's identify it as a problem. And I think that's kind of the root that I want to get at with this discussion is that we sort of see these things, and I think a lot of people will look at them and say, well, that's a dysfunction. We need to address that. It is, you shouldn't have these limitations. You should be able to move through multiple ranges of motions and pass these, these general tests, so to speak. So if we were to identify this as a problem, specifically in regards to overhead mobility, I would say that most bodybuilders are unable to perform a standing or even seated overhead press without some sort of significant hyperextension to their low back due to this, restricted mobility. So for those people who can't perform that exercise, um, would you say that? I guess would you say that is a dysfunction? Should they be able to do these sorts of things? Is it something worth addressing?
Okay, no, this is good. And I do think it gets to the root of a lot of these discussions, not necessarily this specifically, but the ensuing discussion, I think, is applied to any time that we are identifying what we feel is a problem and then deciding it's a problem and then deciding to intervene on it because everything has an opportunity cost. So if you're deciding that something's a problem and you're going to now spend time intervening on that thing, that's time that you are no longer going to be spending with something else. And so it's important to make sure we try to get to the stuff that's going to actually make a difference. So my in general, I'll get to the overhead example specifically soon enough, but in general, I don't create the goals for my athletes. And what I mean by that is if it's a bodybuilder or a power lifter or whatever, weightlifter, sprinter, if they're coming into my office with specific goals, I don't necessarily create new health and longevity goals for that person. What I do is I am interested in longevity within their desired activities. But for example, if a power lifter who doesn't put their arms over their head for sport comes into my office with shoulder pain or whatever, or maybe even they're coming in with back pain or knee pain, or doesn't have anything to do with the shoulder, and I just happen to, for whatever reason, check their shoulder range of motion, and they have like 135 degrees of overhead flexion, which, if you're not familiar with that, doesn't put you very close to being overhead. So this is now a power lifter whose arms don't go over their head, but that's not relevant to their goals and their goal activity. Now, if they're coming into my office saying, yeah, I can't reach up into the top shelf and grab my dishes because my arms don't go over my head, okay, then that's now something to address. But if that's not the case, I'm generally not sending my person out with 67 more problems than what they came in with. So I call it chasing ghosts. So that's kind of bare minimum. I want to make sure that I'm addressing things that are relevant to what they care about and what they want to get back to. And in general, I'm not injecting my own views on health and longevity within that person as a physical therapist. So, for a bodybuilder, they might want to train their shoulders and their triceps with overhead movements. So now it's becoming more relevant to put their arms over their head, and they come to my office and saying, either these movements are very uncomfortable for me. I want to train them. I want to train my lats. So I want to do overhead pulls. I want to do overhead pushes. These are part of my goals. So then now it becomes more relevant. So I think it's important to make these distinctions where we're not just looking at arbitrary markers of what we think is healthy for the human body as it doesn't or does relate to the person's actual goals. So let's say that the bodybuilder came in, they said, I want to go overhead, I want to train overhead, but I can't because the positions seem difficult to get into. My arms just don't seem to go there. I take that as the prior information that I have, and then I check objectively whether that's actually true. And what I mean by that is, do the joints actually not have the range of motion, or does this person not have the coordination, essentially the skill to coordinate their trunk and their arms in an overhead pattern? And that seems silly, but a lot of times what you'll find is that the person perceives that their arms don't go over their head, but when you lay them flat on the table and you just test passively their shoulder range of motion, they've got plenty of shoulder range of motion. They just don't know how to actually express it under load in particular patterns. So that's the next kind of level is it actually that their joints don't go into position, or is it just that they don't know how to organize themselves into that particular movement? So now let's say we've established the fact that the shoulders literally don't have it. I watch them try to put their arms over their head. They get about halfway, and then they have to arch their back to get the rest of the way. And then I lay them on the table, and that is very similar, even passively. Their shoulders lack full overhead range of motion. So it would make sense that if they're going to put that bar over their head, their body is going to figure out a new solution, which is, I think, what you're getting at. They're going to arch their back. So it's not that they suffer from anterior pelvic tilt. It's just that they have a particular task they're trying to get done. They have maxed out their individual constraint of shoulder range of motion. And so they can either drop the bar, or their body can figure out a new solution, which is essentially to arch their back and make it a bench press, so a standing incline bench press, which is, if anybody's familiar with the sport of weightlifting from 1972 and prior, the clean and press was the third lift. Before the snatch and the clean and jerk, it was the clean and press. And if you watch those presses, essentially the lifters would make it an inclined bench press. They would arch their back, they would hang on their belt, and they would arch their back, bench press it off their chest, and then bring their torso forward to finish the lift. So in that respect, would we look at that and say, oh, that's bad? Or would we just say, no, what they were doing was picking the strategy that's going to maximize performance? So that's another element of this conversation, is that health and performance are often inversely related. The strategy that yields the best performance is not necessarily the strategy that is going to put the least pressure on the tissues. So that's like another kind of side conversation that we can have. But so for this particular bodybuilder, we say, okay, it is a problem in the sense that you have an individual boundary, you have an individual constraint that your shoulders lack the range of motion for the desired task. So in that respect, it's an issue. So you have choices then. You could just not train overhead. You could still work your shoulders by doing raises and even landmine presses, and just kind of stay in that almost mid overhead range, doing like pull downs and presses and that kind of that landmine angle. You might not get as much hypertrophy out of that, but that's always an option, to just say, you know what, I'm just going to work within the range that I have. The other option is to say, well, yeah, let's try to both address the coordination aspect of things and let's try to get the shoulders to have more range of motion. That's just not easy to do. And I think that's where people kind of beat their head against the walls. Like it's not easy to literally change your structure and change the amount of excursion that your joint will express. That takes sometimes there's a ceiling to it, and sometimes it's just bony structure that's not going to change. And other times it's soft tissue that's going to take many exposures of very boring, kind of loaded-ish, stretchy that look like stretches, but they're really just loaded exercises. It's going to take a lot of that for little change, like 10, 15 degrees over the last 3 months of repeated exposure, like that type of thing. And if you're not willing to put in that type of work, then, maybe we should think about just kind of modifying your training within your individual constraint. So that's a lot of talking. I'm going to stop and I'm going to throw it back to you, and then we can redirect.
I thought that was absolutely fantastic. And you touched on a couple of really interesting things that I want to get more into. And so in this specific discussion about an overhead press, I've seen it to become pretty popular amongst bodybuilders that instead of actually trying a traditional overhead press, a lot of people are just opting for like a high incline as their quote unquote like overhead pressing movement. And I think many perhaps on the outside of the community would look at that and just be like, well, that's a cop out. Like you shouldn't just accept this limitation. Whereas you're putting this under context and explaining that, well, is it worth the investment of time to do all of these little things to, gain that range of motion, which you might not actually gain at the end of everything. If someone was really interested in, opening up this limitation and being able to perform a true overhead press without compromising their lower back or severely arching in the process, you kind of alluded to the best strategy might be some sort of light loading in this position to develop coordination. Is that primarily the go-to route here? It seems like static stretching has fallen out of favor, probably for good reason, but would you say that's probably not the best way to go about this and we should utilize some sort of loaded movement if we want to gain access to that range of motion?
So first of all, I don't think it's a cop out. But you're right. Like that's what a lot of people will say. You know what that is? That's people putting an arbitrary standard on somebody else. They're putting their arbitrary standard on somebody else. A bodybuilder is not. They're not interested. So correct me if I'm wrong. I'm certainly no bodybuilder. You can just you can see that, but they are not competing in the incline bench or the overhead press. They are using those tools to build muscle. The goal is muscle building, hypertrophy. An incline bench press, I don't know any evidence that says an overhead press is going to hypertrophy your delts and your triceps and whatever else, your traps, more than other bench press derivatives and other isolated derivatives or cable exercises that you could do at higher volumes with multiple angles. So there are always workarounds. The goal is muscle. If the goal were competing in the overhead press, if that was your sport, or if you're a weightlifter and you have to do the split jerk or the jerk, now we're having a different conversation because now literally being overhead is part of the sport. It's part of the task. But when people start throwing out their arbitrary standards, I think it's ridiculous because it's literally their bias. They're just injecting their own view of the world onto somebody else. So with that aside, if the person just says, you know what, I know hypertrophy is the goal, I just want to be able to move overhead and I want to be able to train overhead. That's fine. That's good. That's a different story. Now it's the person who it's the only person I care about is telling me that's what they want. Now I'm going to be realistic about the prognosis. If it's a 50-year-old who's got 30 years of training under their belt and they're missing 50 degrees of overhead range of motion and they're like, yeah, I want to make it my goal in the next 6 months to be able to train the overhead press without limitation. It's going to be like, okay, I'm going to help you get as much out of this as possible. but I cannot promise you any type of timeline or where the end point's going to be. So it's like always like setting realistic expectations, just kind of based on the person. Now, to your question of how we actually address it, there are lots of different ways, and it's probably not a whole lot different. Like, I'm not going to say something in the next 5 minutes that's going to be groundbreaking and that it's going to be something that people don't do. But I think these are things that people don't do. They're almost so simple. People look for the more complicated answers, and they also don't run these interventions long enough to see change. So it's one of those things where it's like if somebody's hurt and you're like, well, just go like a little bit lighter for a little bit. And like things will probably calm down and they'll be like, I did go lighter. I went lighter last Tuesday and it still hurts. Like, okay, well, it's like one time. So like maybe for longer, like give Mother Nature a break here. So it's the same conversation in this regard. Think of all of the training variables that you can manipulate that might give you a little bit more breathing room when it comes to being overhead. So I mentioned a variation. So all the different variables that we have at our disposal, the variation of the movement. So let's take an overhead press with a fixed bar. So we've got this perfectly symmetrical barbell that's engineered, doesn't care about your shoulder range of motion limitations. You've got to go around your face. Like that's a very unforgiving implement when you're dealing with some type of structural barrier. So right off the bat, you can chop that barbell in half, so to speak, and use dumbbell or kettlebell. And what dumbbells or kettlebells allows you to do, and it could be unilateral, bilateral, but what dumbbell or kettlebells allow you to do is that they allow you to experiment with the angle a lot more. And so the angle of your forearm, the angle of the elbow, where the elbow's pointing, straight out to the side versus straight forward and everything in between, it just gives you a lot more wiggle room to kind of find your quote unquote groove, at least to get you into the ballpark. So it's like an entry point. And that's what I'll say a lot to people is like, we're just looking for entry points into this pattern. So right off the bat, using some type of unilateral implement like a dumbbell or kettlebell will likely allow you to find a more comfortable overhead position. So that's one variable. That's a big rock. It's a low-hanging fruit. And again, it's one of those things that almost sounds so simple. Well, no, that's not mobility work. That's dumbbell overhead press. No. That is mobility work because every repetition, you can fight for that extra 1 degree of overhead range of motion. Like for somebody who struggles with being overhead, that the lockout part of the movement is going to be really difficult. They're going to want to just stop the rep and go back down. But that's why I tell them, no, I don't care if it takes you 10 seconds. I want you to push into that end range, get used to that position because that's where you want to be. And the barbell is going to be, or a dumbbell kettlebell is going to be a little bit more forgiving than a barbell. So think of it that way. And you could do it in seated with your back up against the edge of a bench or against the back of a bench where the bench is maybe slightly inclined backwards. And so you get a little bit of breathing room there, but you can use the back of the bench as kind of a cue. So you keep your tailbone and you keep your upper back against the bench and there's a little bit of a curve in your lower back, but you just maintain that position the entire press. And so you got a little external feedback there. Really, really useful. So that's mobility work right there. And then let's say that you can't do that every single day because anything can be overdone. It's like, well, I want to get some other variation in there. I mentioned a landmine press earlier. A landmine press is actually really useful. So if you're holding the end of a barbell and maybe you're in half kneeling or standing, it doesn't matter, and you press that bar, and now you're kind of in a middle range of a horizontal press and an overhead press. Well, you can kind of lean forward into the bar. So you push the barbell away from you, keep your elbow locked, and then you kind of lean your body into the bar. And what it does is it opens the shoulder up. You get more flexion. You're essentially using your body weight to leverage forward. I call it a landmine press with a lean, but you're using your body weight to leverage forward into the press, and you're pushing against the barbell as you're pushing your body weight forward, and that shoulder angle opens up more. So it's kind of a way, instead of just jamming something over your head, it's kind of a way to ease into the position a little bit. So that could be maybe like somewhere later in the week or something. So you've got a day that's dumbbell or kettlebell seated press, and you've got two days later you're doing a landmine press with a lean or something like that. So these are exercises that can be progressively overloaded, but each repetition is very focused and it's very deliberate. Every rep is deliberate. You're trying to squeeze that last little bit every single repetition. It's tedious as hell, but that's what creates change. So variation is one, and then we can use things that are probably maybe what you would see as more traditional that would kind of look like stretching, but really they're active. So like a hang from a pull-up bar where your feet are, I like to put people's feet on a box in front of them so that they're in full control of how much body weight they put into the hang, because that's going to be kind of a lot for people who aren't used to having their arms over their head. So their feet are supported on a box in front of them, their knees are bent, and they can just kind of let gravity and their body weight sink them into position. But it's not passive because their shoulders are active, they're hanging. So that like something's holding their shoulder in place, right? It's their muscles, but it's kind of that eccentric load. And then if you get more comfortable, as you let gravity pull you down, pull you down, pull you down, your arms get more and more over your head. You can kind of actively pull yourself more under the barbell so you get more of a straight line. But you can do that for sets of breaths. You know, I'll program 3 or 4 sets of 5 full breath cycles, something like that, where you're just kind of like letting yourself relax into that position. And that would be a quote unquote stretch, but it's an active variety and it's graded because you can put more and more of your body weight into it. And because it's a lower level exercise, that type of thing can be done with more frequency. And it can maybe even be done in between the sets of your overhead exercises or your upper body work. So if you're doing the dumbbell presses or the landmine presses, like I said, in between your sets, you can go over there and do a lat hang. A supine pullover is another option. Now in bodybuilder world, it would be like taking a dumbbell and just kind of your elbows are slightly bent and you go maybe like most of the way over your head, but not all the way over your head. This is a little different, where I'll have people hold a PVC pipe and with a little bit of weight on it. So we'll slide like a 10-pound plate into the middle of it or something, or whatever's heavy enough to actually get them to move their shoulders. But their back is kind of pinned to the bench. So they're laying on their back and their tailbone and their upper back are pinned to the bench and their lower back has a little bit of a curve in it, but just normal. And then their elbows are locked and their hands are gripping the PVC pipe in a press width, whatever their pressing grip is. And then they just go over their head with the weighted pullover, with the weighted PVC pipe. But the idea is that they keep their back and tailbone anchored to the bench and they just go to whatever their end range is. And they hang out at that end range, take a couple breaths, keep their elbows locked out, bring it back, rinse, repeat. That's another exercise that can be done in between some of your actual progressively overloaded exercises like overhead pressing or even your lat pull downs, like anything that's over your head. In between, you can be doing some of these quote unquote loaded stretches, so to speak. Passive stretching. So to your point, you know, it's not that passive stretching doesn't do anything, because it certainly does. There's plenty of evidence that says passive stretching provides that short-term change in range of motion, but so does just warming up and training. You know, there's no special effect of passive stretching, and one of the reasons it's falling out of favor is because the effect is just that. It's just not giving you a whole lot in the long term. It's not enough mechanical tension to create structural change for trained individuals for the most part. It's it's just not enough stress to really perturb the system enough to create the change that we're looking for. It's not that it doesn't do anything. I mean, if you like it, my thing is if you like static stretching and it feels nice, go ahead and do it. Just don't expect that if you don't change anything else in your training and you only add that, don't expect a whole lot to happen. So I'll stop there. See where we're at.
I think that was much needed context overall, and then the practical takeaways here for, several exercises that people could start implementing if they did want to improve this. So I think this is fantastic to kind of perhaps sum up these general principles before we move to something slightly different. We primarily stuck to the concept of overhead mobility, but when it comes to these other common adaptations from these primarily sagittal plane training strategies seen in powerlifting and bodybuilding, it sounds like you might say that these are just simply adaptations to the specific stress being imposed, and that these aren't negative consequences, they're just an outcome. And if you don't feel pain in your everyday life or experience any issues from these, then they're not necessarily a problem that has to be fixed.
Yeah, I would agree with that.
Okay.
I just got to talk to the person, if yeah, because people will come to me and they'll say, well, I want to prevent injury and I want to maximize my performance. And I'm like, gosh, like I want that for you too, but there's a little bit of a trade-off. Maximizing performance by its very nature, you are increasing your exposure to risk because you are purposely pushing thresholds. We are asking our system to do a little bit more than it's used to repeatedly over time. By definition, that's risky than not doing that. So when somebody's like hell bent on never getting hurt or experiencing pain and they want to maximize their absolute output, it's tough to reconcile those two things. So we have a conversation where it's just more realistic. We're like, we're going to be better at managing and mitigating risk. But if our goal is maximizing performance, then there's some degree of acceptance of risk and uncertainty within that realm as well. But yeah, I would say to your point, we have to define the problems for the particular person, define their goal activities, define where they want to be, where they currently are, what can fill that gap, rather than making blanket statements as a whole. Now, it may very well be that those blanket statements sometimes apply in the very cases that somebody who makes those blanket statements would say, yeah, see, I told you so, but it doesn't apply to everyone in that same way. And I think that's maybe what we're talking about here is nuance and context.
Yeah, and that's much needed. I think for a lot of these upcoming questions, there's going to be a lot of it depends. And as we know, for a lot of people, that they don't love that answer. But as I like to say, if you're really interested in getting the quote unquote right answer or getting really close to the truth, it's going to be something very gray and, based on this concept of it depends. And anyone who wants to give you this absolute black or white, good or bad, you're probably not getting a very good answer.
Well, and we can be a little bit better because I agree. It's annoying if somebody just says it depends and then just leaves it at that. But
Yeah.
we can try to parse out what the it and the depends is, and maybe that'll bring a little bit more light to the discussion.
For sure. So the next thing I want to talk about is, again, another common thing we see in these populations is limited ankle dorsiflexion. And in the case of bodybuilding, I think there's probably good reason to find some sort of squat pattern that you feel comfortable with and allows you to more or less get your knee, like achieve a great degree of knee flexion in the bottom. And what I see from most bodybuilders is that, they're stuck to this concept of I have to perform the barbell back squat. But in order for people to get a reasonable range of motion on that, it seems like they're usually taking this very wide stance. Maybe they're even going for a low bar position because that makes it comfortable for them to get into the hole. But we're not getting a whole lot of range of motion at the knee and probably less quad stimulus than we could get from something else. It's a very hip dominant pattern. Could you potentially touch on why somebody might struggle to have a more vertical torso in their squat or be able to their knee past their toes to really maximize the quad stimulus they're getting with that variation?
Yeah, well, for the whys could be many different things. Again, it's very similar to the shoulder conversation. Do the joints literally not have the excursion for the movement, or do you just not know how to coordinate your body within that? So somebody's air squat or body weight squat could look like a certain way, and if they just hold a kettlebell or a dumbbell in front of them and do a goblet squat, all of a sudden the optics are a lot better. So in that example, your joints do have the excursion that we're looking for. What you lack is the coordinative skill to put it all together. When a bar is anchored on your back and your arms are kind of tied up, it's the same idea. Do your joints literally not have the excursion, or do you just not have the ability to control your trunk and move your lower extremities at the same time? So because I don't have a specific person in front of me, what's generally helpful is not trying to focus on one particular joint, because what's going to put the most mechanical stress to the ankle and what's going to get them to end range the most often with the most payoff is going to be the squat itself. So loaded calf raise. I mean, why make this simple? Just move your ankle, or why make this complicated? Move your ankle under load. And you want to grow your calves anyway as a bodybuilder. That's your ankle range of motion training right there. Seated, standing, you're moving it through full range of motion under load. A mobility, an ankle mobility drill that you saw on the internet does not do something different than you simply moving your ankle through full range of motion under load. To the extent that your ankle will change, that your range of motion will improve over time, will be dictated by the time and just the genetic predisposition of that, and whatever your tissues are going to allow. But that's going to give you the most bang for the buck, is probably the stuff that you're already doing. So then we have to just teach you how to coordinate your body during the squat pattern. So there's a lot of different ways to do that, and it's this constraints-led approach. It's, again, manipulating training variables to teach somebody how to coordinate their body. So usually, let's say they're doing a high bar squat or a closed stance squat because the goal is quads, and they have that bar position, and you watch them squat, and somewhere like halfway down, you see their butt starts to shoot backwards and their shins start to go vertical, and it basically turns into a squat morning, or basically turns into a low bar squat position in a high bar squat. So then you say, okay, I want to fix that because I want to keep the mechanical tension on the quads and through that knee extensor mechanism. That's totally fine. It makes sense to me. So what we could do is add an external constraint there that essentially makes the task either impossible to do without the pattern that we want, or it teaches them how to kind of push that skill acquisition boundary. So for example, squatting to a box, not back to a box, not a West Side Barbell box squat, where you're deliberately sitting back to the box with a vertical shin, not that. A squat to a box, which is directly under your butt, you're squatting straight down to it, but the height is set just past the point in the range of motion that you start to shoot your hips back. And the goal is that's your external cue to maintain that position just a little bit longer than what you usually do. And you're not going to fall on your butt because you've got the box there. It's going to be hard work, and you're going to probably feel your quads burning and even the front of your shins, because your anterior tibialis is working to keep your ankle in dorsiflexion actively. So all that's going to be burning and on fire, and you're probably going to be breaking a sweat with like 135. But that's the point. You've got to make it hard to relearn. So this is the idea of deliberate practice, where now you're using variations of the squat to teach you the pattern that you want. And it's got to be hard enough that you learn, but it can't be so hard that your body just reverts back to the old pattern without you being able to stop it. And it can't be too easy that it doesn't teach you anything. So if you're trying to learn algebra and I drop you into kindergarten class, you're not going to learn a thing. But if I drop you into rocket science class and quantum physics, it's going to be too hard, right? So this is the idea of finding that middle ground, finding that threshold. So a squat to a box right at that technique threshold is one really useful strategy. Another strategy is a pin squat. Same idea as putting the pins in the at the point in the range of motion where you start to get wonky. But the cool thing about a pin squat is once you go down and you set the bar on the pins, if you try to lift the bar off the pins in your old strategy with your ass 10 feet behind the bar, you're not going to be able to do it. You have to get, in order to even complete the task, you have to get your hips underneath you, which is going to in turn drive your knees forward and put more of the mechanical tension in your quads to even do the movement. So a pin squat, without having to say a whole lot as a coach, teaches the person how to use their quads in the squat. And then obviously over time, you can lower the pins, you can lower the box, you can have a day of where you're doing pin squats to kind of teach the pattern. And then maybe even right after that, you're doing your high bar squats to see if it transfers. So it's fresh in their mind. They know the feeling. So you basically use the pin squats as a glorified warm-up skill acquisition movement. It's not super heavy and it's not accumulating a lot of fatigue, but it at least ingrains what you're looking for. And then you finish off with your regular high bar training and you hope that there's some transfer there over time. Now you're always going to revert back a little bit to your old habits because that's just the way this works. But over time, you start seeing that transfer over more and more. So those right there are low-hanging fruit that I think are going to give way more bang for buck than trying to do some type of isolated, low-level, low-load, like passive joint strategy. Beyond that, variation, we can move variation even further and go to unilateral. So in the same sense that a dumbbell and a kettlebell was just easier to leverage your shoulders in, something like a split squat can be easier to leverage yourself into your ankle. So what I call it an ankle focused or a quad focused split squat, where instead of that front shin in a split squat being vertical like is traditionally taught, you're deliberately driving your front knee forward over your foot, over your toes, on the way down and on the way up. You drive your knee forward to stand up out of the hole. And the benefit of the split stance is that that back foot can kind of push you forward into your ankle. You just have a little bit more leverage, and you can hold dumbbells, you can load it with a barbell, but a split squat with an ankle focus to teach you how to drive your knees forward. Give you that feeling. It's like, oh, this is what it's like to keep mechanical tension in my quads. The beauty of that exercise is not only does it teach the skill and the coordination of that, but it's also itself just a nice accessory movement for the quads. Like that could be progressively overloaded. And then another strategy that it's almost this weird, like people are either for or against. It's like duh, or it's like no. And that's the use of elevated heels and the use of a weightlifting shoe. And when I say weightlifting shoe, it's the sport of weightlifting, and it's a high-heeled shoe, which is used by a lot of powerlifters in the squat. But it's this thought that some people think, well, if I'm wearing a heeled shoe, that's cheating or something like that. And it's like, well, you also lift that perfectly engineered symmetrical barbell. And you know what I mean? And you're bench pressing on that perfectly stable and level bench. So if we're going to play that game, you got to get rid of all of your equipment and just go out there and lift a bunch of logs and a bunch of like, and I wouldn't even say stones, because in strongman, those stones are round, they're engineered in a certain way. So you got to go out there and lift like oblong boulders if we're going to play that game. So that argument makes no sense to me whatsoever. The other argument that I hear, which I feel is untrue, is that if you wear a shoe with an elevated heel, then it's essentially a crutch. You're no longer using your ankles, and so you're not going to improve your ankle range of motion if you wear weightlifting shoes. My argument is actually the opposite, in that if you are somebody who knows what it's like to have crappy ankle dorsiflexion and just get your hips shot back, it is like a breath of fresh air when you put a heel on and you're actually able to drive your knees forward. So it's this weird myth that a heeled shoe is almost like a cement block, and it's like a brace that now your ankles are not moving during the movement. But that's not true. It's giving you a head start. So now basically it shifts your center of mass up and forward. So now you have more leverage to actually dorsiflex your ankles because you're up over the top of them a little bit more. as opposed to just getting kicked back so soon in the movement, you don't even have a chance. So wearing your ankles will still move if you have weightlifting shoes on, and I think it gives you better leverage to actually use them in the first place. And I'll even have people, not for their top working sets generally, but like for their warm-up sets, for some of these pin squat, squat to box, split squat with ankle focus, I'll actually put a plate, sometimes even a small change plate underneath their weightlifting shoe to give them even more of a heel lift, to just exaggerate what we're trying to do. And obviously we wean them off of that, but it's like anything else. Like we don't poo-poo on somebody who's like trying to learn how to shoot a free throw, and we break it down and we have them practice and we give them maybe a little easier something to make the task easier to do, and then we pull that back. It's the same idea here. You know, you've got strategies to make the skill of a high bar squat and using your quads more viable. And I think a heeled shoe or added heel elevation is just a teaching tool essentially.
Fantastic. I couldn't agree more. Yeah, personally, I've been told in the past that, you know, for wearing heeled shoes is just a crutch, and I should be working on my ankle dorsiflexion. I personally, I have like 2x4s for ankles. Like dorsiflexion is just like extremely limited. My current primary squat pattern, as far as a free weight squat goes, is I use a squat wedge, and then I also use a safety bar for my squat, and that allows me to get a great quad stimulus. With that being said, you kind of touched on potentially using some unilateral stuff to really get that knee forward and emphasize the quads. Most bodybuilders will kind of just opt for a leg press or a hack squat, but for those who are looking to utilize some sort of dumbbell or barbell variant, maybe because they have limited equipment, are there patterns that you are there exercises that you typically see don't require much of a learning curve? People can kind of just get into it, and it usually feels pretty good. And they'll notice even if they have limited dorsiflexion, this exercise tends to resolve that, and they get a good quad stimulus from it.
I think the split squat with the quad focus is the one. First of all, leg press and hack squat are good options too, because you can manipulate your foot position to get more ankle. You put your foot lower on the pad or lower on the block or whatever you want to call it on the leg press. As the weight comes down, your ankles will just inherently start closing down more. You'll get that positive shin angle, which like you're in full control, of how much that occurs just based on your foot placement. So that is ankle mobility work under load. So that's a viable strategy. But the split squat is probably the simplest one. I love goblet squats for the simple reason that counterbalance really allows the person to just have full control of what's happening. Whereas when you got a barbell on your back, if you're not super comfortable, you don't have that groove, and you've got a bar that's just kind of like locked in your back, and you're holding your arms way back like that, it just becomes difficult to work on what we're talking about if you don't kind of already have the goods. Safety squat bar I really like because your arms are in front, and it acts more like a counterbalance, and you're better able to stay upright, use your ankles, and you feel more in control. It's just not everybody has a safety squat bar. So I like goblet squats in combination with the ankle focused split squat. And if people are like, oh God, goblet squats, little baby exercise, like I kind of get that, but we're also not talking about these exercises being your main quad hypertrophy, program. They're adjunct to get you to be able to pull more out of the heavy hitters of what you're already doing, like the high bar squats and that family of movements. So we'll do like a superset of goblet squats. Could be a combination of everything that we talked about. You're holding a kettlebell or a dumbbell in front of you. You're going down to a box, straight down to a box, and maybe you've even got a plate underneath your heels. So everything is there to help you stay in your quads. And we could take all of those constraints away over time, but you might ask, well, why? Because my goblet squat two-way box with a heel elevated makes my quads burn as much as anything and puts as much mechanical tension as I can handle. The limitation of a goblet squat is essentially eventually you're going to run out of the ability to be able to bring the weights up, just hold the weights in the air, which is all why we have a barbell. But like if it's quad tension, that exercise and with a bunch of those constraints in place will give you just that. And then if you're worried about, well, I kind of shift to one leg more than the other, that's where the split squat comes in. So you've now got essentially the unilateral variation of the same thing where you can now guarantee the load is going to each leg equally, so to speak.
A quick question about the split squat. Is that rear foot elevated or front foot elevated?
It can be rear foot elevated for sure. Anything that's going to allow you to drive your knee forward. So basically, let's first picture this with both feet on the ground. So no foot elevation at all, just both feet, traditional split squat, both feet on the ground. You're in your split stance. Not a lunge, it's a split squat. Straight down, straight up. But as you go, what's the difference is your stance will probably be a little shorter because you're driving that front knee forward. So if your stance is too long, your front shin is just going to stay vertical. So it might be a slightly shorter stance, but as you go down into your split squat, you're driving the front knee forward. You're driving the front heel down into the ground. So your foot stays flat, or if it's on a plate, you drive it into the plate. But regardless, your foot stays anchored to whatever level it's at to start with. You drive your knee forward on the way down. You get all the way down to the ground or wherever you can go to. And then to stand up out of the split squat, you drive your knee forward to stand up. And that mitigates what happens a lot with people in a squat is their hips get kicked back behind them when they stand up out of the hole. So essentially they drive all of the mechanical tension to their hips and their lower back, which is fine if you want the mechanical tension in your hips and your lower back. But if you want to stay in your quads, keep your hips underneath you. So that's the cue in the split squat. That's the same cue in the goblet squat. Drive your knees forward on the way down, feet stay flat, drive your knees forward to stand up. And so it can be rear foot elevated with those exact cues. And a rear foot elevation probably puts even more emphasis on that front leg, which is a good thing. I don't generally recommend a front foot elevated for this particular task because the front foot elevation makes it a lot harder to stay in your quad. It's more of like a hip range of motion exercise. That's just kind of what I've seen in practice. So generally it's a traditional split squat with both feet on the ground, or it's a rear foot elevated split squat if we're going for quad.
Awesome. As we're kind of touching on these arbitrary limitations that a lot of people like to impose on lifters, I think we should briefly mention the push-pull ratio that commonly likes to be talked about. I can think of a couple of practitioners who have suggested that you should do 3 times as much pulling to your pushing volume, and this is absolutely essential to prevent shoulder injuries and to decrease risk of just overall injury. What are your thoughts on this? Is there any logic behind this position?
It's a good question. And before I forget, there's another split squat variation that I like is with both feet elevated. So let's say both feet are up on like a 2 or 3 inch bumper plate, but then you've got a deficit in the middle of them. So you get lots of range of motion. You get like basically a full range of motion squat, and you can drive the knee forward. So double elevated split squat. I just want to throw that out there so I didn't forget, but it's a really good one. So the push-pull ratio, it's one of those topics that if you're annoyed by the dogma of it, you just kind of throw the whole notion out. But so if I parse it out, there are places in the body and in the literature where asymmetries seem to matter. So they're very specific. With ACL rehab, after an ACL reconstruction and injury, we're looking for a certain degree of quad strength symmetry between the affected and the unaffected leg. We want that to be at least 90%. So we want the surgery leg to be at least 90% of the strength in the quad extensor, knee extension strength, as the non-surgical leg. So there's that. There's also the quadricep to hamstring ratio. Again, only after ACL reconstruction for that specific particular subset. In overhead athletes, there seems to be some type of relationship between internal rotation strength and external rotation strength measured in the open chain. And we're talking mostly for athletes who throw a ball. We want external rotation strength to be as close to internal rotation strength as possible. 70, 80, 90%. The closer it is to a one-to-one, the better. Now, I just listed 3 very specific populations, and I'm not really aware of much else beyond that where we actually have any data to support some type of specific ratio. So with that said, I don't know of any other support other than just anecdote and just kind of the, colloquialism of push-pull ratios that people have just taken through the years and said, this sounds like a good idea. And then people kind of have put their own spin on it. I could be wrong, but I think it's just coming from basically the priors of all the past coaches. And I think it's probably extrapolated a little bit from the specific populations that I just talked about. So when we see those types of things in the literature, we tend to make leaps and we tend to take those and extrapolate them to different populations and different scenarios and make them more of just kind of an umbrella recommendation rather than saying, well, no, actually, that's just for that specific population. I can't actually make the claim that it applies over here. But we do that a lot. I do it. We all do it because we want these things to make sense. So I think that's what happened. Here's where I think there's still some discussion to be had. So let's say a powerlifter, because for a bodybuilder, it's about building muscle. So to me, you skew your ratio of push-pull based on the part of your body that you're trying to focus on for that particular block, rather than some type of injury prevention strategy, because I'm just not sure there's much to support that, because it could work the other way. If somebody just inherently does a shit ton of pulling, then you could say, well, actually, you need to do more pressing. But we never say that. It's always the other way around. It's always you're doing too much pressing. Like literally, you don't even look at the program. Oh, your push-pull ratio is off. It just feels like it's that dogmatic at this point. But if you're a power lifter, you're very, very likely doing more horizontal pushing than you are horizontal press or pulling. If it could be an issue in the sense that if I keep seeing in your training that you don't keep your upper back tight during the bench, you don't keep your upper back always gets rounded over during the squat, it always gets rounded over, and your bar always gets pulled forward during the heavy deads, I might then say, I want to work on pulling strength and just get some more meat and pulling force production capability to augment the performance of these error or these kind of barriers that I'm seeing in your lifts. So that's then I would look at training and saying, well, we're not really doing any pulling. I'm going to add more pulling volume, and that'll skew the ratio to some degree. But that's not really kind of what we're getting at. But that would make sense, that type of argument, to add more, to look at pulling and to add more of it or something like that. If a power lifter does a ton of pressing, horizontal pushing, and almost no accessory pulling other than their deadlifts, and they're good, like they're not hurt, they don't have much injury history at all, and their performance is going fantastic, there is no evidence that I'm aware of that would support my claim of, well, even though everything is going splendidly, your push to pull ratio is way too high, skewed towards pushing. I want to reduce your injury risk by adding more pulling. I don't know if that claim is justified. And I think that's kind of what we're getting at here. if somebody's hurt, if pulling or if pushing hurts now, it's painful, adding more pulling is not a bad option, but I think for reasons not having to do with the push pull ratio being fixed. I think it has to do with if your pain is happening during pressing, during bench pressing, well, now you're probably not going to be able to do as much bench press. So that's just overall a decrease in your training load. And if we want to fill that gap a little bit with something that's not going to hurt, but something that's at least going to keep you in the gym and keep some weight on your body, well, we can probably do pulls, like some pulling accessory. But it's literally just it's a filler. It's a way to reduce the opportunity cost. And I can't push as much. What else can I do? Well, we can pull. So that's one reason why you might change up your push pull ratio, but it doesn't mean it's not because the pulling is what's fixing the issue. Another reason is just the simple notion of novelty. So whether you're a powerlifter, a runner, a sprinter, a jumper, even more complex sports like basketball and soccer and these types of things, football, you do have repetitive stress strain patterns going through your tissues. And that tends to, when you're just constantly stressing the tissues in the same type of pattern over and over and over and over, it does tend to lend itself sometimes to these what we call overuse injuries, which is just too much of the same thing. And we overflowed our bucket. So in that sense, while while you're kind of pulling back on the repetitive strain patterns and Mother Nature is just letting that stuff cool off a little bit, adding in some novelty and just still straining and stressing the tissues, but just in a different distribution, just a literal different line of pull and force can be more tolerable. And so in that window of time where you're healing and not able to train the way that you normally would, adding in more pulling is just another variation of novelty. But again, it's not necessarily the intervention of the pulling that's somehow this therapeutic antidote. Does that make any type of sense whatsoever?
It absolutely does. I thought that was excellent. And just like everything else we're talking about here, you're just providing so much necessary nuance to these concepts. And then of course for, this specific push-pull ratio, just mentioning the literature on the topic and just, perhaps for a lot of these ideas, it does come down to maybe just coaches who have been around, just repeating what other coaches say and perhaps extrapolating research that like kind of applies, but it really doesn't to it's a very, like you mentioned, there's stuff on very specific populations, but that doesn't mean we should be taking these findings and then applying them to everyone who could be even slightly related to the population tested.
Yeah. And it's not me, like I hate poo-pooing on this stuff because like if I take an absolutist approach, that's just as closed-minded, but it also now I can't do things that look kind of like what I'm poo-pooing on, which is like if somebody comes into my clinic and they have shoulder pain with pressing, like I very well may add more pulling into their programming, but it has to do with the reasons that I outlined, not because their push-pull ratio was 2.3 and I want to make it 1.2. You know what I mean? I'm not looking at it from that lens because it's all arbitrary. We don't have prospective data to tell us what at least I'm not aware. I could be totally wrong on this, by the way. So if a listener is like, no, you're actually like, you have no awareness of the current body of literature on the topic, here are some references. I'm happy to read those. I'm not aware of any. And so if we're just pulling numbers out of thin air, now it just becomes well, who's right? And it's usually the coach who yells the loudest or has the most experience or the most Instagram followers or trains the most pro athletes that wins because they have the most clout. So instead, we can say, well, their shoulder hurts in the bench press because the world is complex and who the hell knows why, but we overflowed their envelope of function within that particular pattern. We we either underprepared or we did too much too soon. And now that particular pattern of force distribution through the tissues is not tolerated by the body. We can simplify it. We just surpass their envelope of function. We say, okay, well, that's it. So we manage the training load within that particular trigger pattern. And we say, well, they can tolerate intensity still, but they can't tolerate volume. So at least we can stay heavy. Or they can't tolerate heavy loads right now, but they can tolerate volume. Well, at least we can do volume. Or neither. They can't go heavy. They can't go into fatigue. Well, shit. We'll do a bunch of clusters at light loads. At least we're doing something. But since we can't train our pressing like we normally would, I'm going to add a bunch of pulling to just supplement some volume and maintain some muscle mass and at least maybe get their back stronger, because that can only help a power lifter. Because when you're rehabbing, it's non-specific by nature. Like, you should just throw that out. Another thing about this is the specific police, the specificity police, as I like to call them. Like, you'll hear me loving up on the set principle as much as anybody else. But in a scenario where you're hurt, specificity takes a back seat to just continuing some type of training while we trust that Mother Nature is going to perform her healing and adaptive processes. So pulling might just be a way for you to keep the person training and keep them feeling like they're working hard, you know? But if it was the other way around and they hurt during pulling exercises, well, now your holy grail is out the window because it's opposite. So you just have to be willing to see it from both sides. And if we take these more just general principle and heuristic based approaches rather than these very specific numbers and specific principles or recommendations that are not really rooted in anything other than expert opinion, I think it gives us more options.
Very well said. I do think it's fascinating, like you mentioned. It's always you're doing too much pressing. It's never you're doing way too much pulling. Like, there's never enough pulling ever.
Exactly.
Throw in more.
Exactly. So if there's never a wrong answer, I mean, you should be real skeptical of that. Like, if the answer is always do more pulling, right?
Yeah.
Come on now.
Pretty interesting. Do you have time for one more question on recovery?
Sure.
So, in terms of recovery, it seems like it's probably a good idea post-training to do something that gets you to relax after this very high-level stress response. And for that reason, whatever helps you relax, if you like to do something, go for it. So, if you like to foam roll or you like to static stretch post-training, like, sure, have a blast. I don't think there's anything wrong there. But when it comes to the current state of the literature, if we're just looking for something which seems to clearly have a beneficial effect for most people to improve their recovery, is there anything out there that seems to be definitely worth someone's time? Last time I checked, there was maybe like a meta-analysis from 2018, and I think like compression garments looked to be pretty good. Perhaps like some active recovery stuff, like low intensity cycling. Where does the literature kind of stand? Is there anything that looks good at the moment?
And other than sleep and nutrition, right? That's kind of
yeah, other than that.
Other than the things that actually aid your recovery. No, so I take a similar stance in regards to like post-training stuff, in that people are free to spend their time and their money however they want. And if somebody wants to foam roll for a little bit after, and it's just kind of a ritual to help them wind down and stretch, like, yeah, no harm done. If they want to go to the nearest performance clinic and jump in some Normatec boots for half an hour, that's fine too. But like, if you're spending money every time you do that, let's just have a conversation that it may not be like the magic bullet that you think it is. And if that's still fine and you still just want to do it because it feels nice, that's totally fine too. So I don't take those things away from people. I just want to make it more of a kind of a realistic thing. It's kind of how I feel about massage as well, as some people enjoy it and like it, and it's therapeutic for them in the sense of they're doing something for them. It's relaxing. And it provides them that kind of wind down routine in a sense. I happen to not like it. I don't like the feeling. The best massages I've ever gotten were from people who had no idea what they were doing. They were not masseuses. So it's like, oh, it's all contextual, right? But it's not relaxing for me. And it almost has the opposite effect. I'm like all wired and like somebody's digging their elbow into me and it's not comfortable. So that I think a lot of this stuff comes down to personal preference. And in regards to specific modalities, I will be completely honest, I'm a bit removed from the literature over the last couple of years because everything kind of keeps saying the same thing. Like we're arguing these two concepts of efficacy and effectiveness. So these are two separate things. A lot of times these are terms that are used interchangeably, but they're not the same. So efficacy is how something works in perfect conditions. So let's say in a laboratory setting, does this blood pressure medication actually lower blood pressure? And how does it do it? So does the thing mechanistically do what we want it to do? And how exactly does it do it? That's efficacy. Then we measure something's effectiveness in the real world. So does the fact that this blood pressure medication that reduces blood pressure, we've already validated its efficacy, does it then decrease risk of cardiovascular incidents in the real world? Is it effective in the real world? That's an effectiveness study. If we find that, yeah, it reduces blood pressure, but it increases risk of stroke, well, then it's not effective. It's efficacious, not effective. Make sense? In rehab land, especially, and with all these recovery modalities, we seem to be just looking at efficacy or effectiveness, and we don't know how this stuff works. So we might see a study on Normatex, or we might see a study on compression garments, or whatever it is, and say, oh, the outcome is decreased perception of soreness, or subjective outcomes of increased recovery, or something like that, or even increased recovery from an objective standpoint. Let's say they have them do the same workout and we do some of these things, and then the two groups, one performs better the second time they do the workout than the group that didn't have the thing. The problem is we're not blinding the groups that get the treatment because it's hard to blind them. So how much of this is placebo? We don't know because we haven't established the efficacy. We go back and say, oh, well, these people perceived less soreness. Well, why? I don't know. Let's just keep selling the stuff. So it's almost working backwards. So the problem with that is we don't know which one is better. Well, is it compression garments or is it Normatex? It all goes into the same bucket because we can't distinguish the efficacy. It's the same with manual therapy techniques and dry needling and instrument-assisted soft tissue. It all seems to have some type of effectiveness to changing perception, changing pain, creating maybe short-term changes in range of motion, but we haven't teased out why. And so now it literally becomes whichever system you like and whichever one you learned first, or whichever thing that you can afford, which is totally fine. So that's literally the conversation that I have with people. If you want to get compression garments because you like the way it feels, go ahead. It's probably not going to hurt. But I can't differentiate it from just placebo. So you could probably also wear a pair of socks that you have in your closet that have been there for 5 years. But the thing is, the socks aren't fancy and they don't look as cool. And so there's that whole non-specific effect of the thing. I know I'm being facetious here, but I'm actually all at the same time not, because I think this all plays a role. I will say this. When it comes to, let's say, a multi-event day, like a competitive CrossFitter or a strongman athlete or something like that, track and field, where you're having multiple events over the course of a day, there does seem to be some benefit to things like ice baths or compression gear, stuff like that, to get you feeling as close to new again before the next event on that particular day as possible. Again, we don't know why. Contrast showers, but the further removed you are from each event. So if you're trying to measure recovery from day one and then from to day four, there's less and less of a benefit to this type of stuff. But in a multi-event day, there does seem to be like some, again, you can basically just pick off the dartboard, whichever one that you want to do that will make you feel as close to new again before the next event. How much of it is placebo? Don't know. Why does it help? There's plenty of hypothetical mechanistic discussions out there, but nobody's really rooted down a whole lot. But I would say that in those instances, if somebody has, let's say ice bath, for example, if they have experience with ice baths, if they like ice baths, and ice baths are available at the venue, go for it. If you've never taken an ice bath, don't make your event day the first time you experience an ice bath. That's a bad idea. If you love ice baths, you're familiar with them, but they don't have access to, you wouldn't have access to them at the venue. You'd have to bring your own tub and your own water and your own ice. I don't know if it's worth the trouble. So that's where I am with all of it. I'm sure there are probably more. I'm actually positive because I've seen them. I just haven't read them. More updated systematic reviews in the last couple of years on this stuff. I'm gonna bet that they don't really say anything different, that they don't add to the discussion. It's probably more of the same, but that's kind of where I am on that stuff.
Very cool. So when we consider this concept of not really understanding how a lot of this works, but kind of take your pick and whatever you like best and seems to work well for you, physical therapy and these concepts relating to this field are a bit outside of my scope, but something that I have seen that seems to be increasing in popularity is this whole notion of the PRI. So PRI exercises being exercises that kind of, I guess the objective with these is to kind of try and reverse some of these adaptations from common resistance training and induce this parasympathetic state. It's focused on, deep breathing in these positions, probably with some sort of posterior pelvic tilt to kind of refresh things and get back to maybe a state of normality. Can you kind of touch on what this is? Because I'm probably not describing it well, but if it's something that seems to be efficacious, or if we can kind of just throw these exercises in the same box with everything else we just described.
Yeah, this one might be tough. Number one, PRI is a proprietary system, and so it just comes with inherent bias of any system that's making money on the system. Number two, I took 2 PRI courses in 2014. And have not necessarily followed the practice since then. So that's now me 6 years removed from just taking 2 introductory courses. So I'm probably not well versed in what the teachings are now. Probably and not the best person to just describe the methodology in the first place. And number two, if you're listening and you're not familiar with what the Postural Restoration Institute is in the first place, I don't know how valuable this will be, but yeah, I think just in short, it's similar to the conversations that we've had, where if we take the branding and all the narratives of the exercises out of the equation for a second and just say, well, these might just be novel positions, just some novel input for the body. Whereas if you're a powerlifter or a bodybuilder and your body is kind of used to being always arching hard in your lower back and anterior to tilting your pelvis, because that's what helps keep your back in a nice stable position when you're lifting, and you're just kind of used to being in these positions all the time, and your body just kind of feels like in those positions right now. And you have a bunch of different options now with a bunch of different low-level drills that essentially have you do the opposite in low-level fashion: posterior pelvic tilt, lumbar and thoracic flexion, deep breathing where your focus is full rib cage expansion, not just pooching your belly out to your belt. A lot of these things can feel really nice initially because they're novel. And so I think there's power there. Again, I can't speak to the algorithms and the rabbit holes as they go deeper and deeper. But if it's at surface level, just some breathing exercises that help you wind down and put you in positions that help you feel kind of quote unquote unstuck. And I cringe even saying that, but I won't even take it further than that. Like you just feel like trash because you've been training really hard and you've been doing the same things over and over for several weeks. And these exercises put you in positions that are different and it just feels nice. And you get up and you feel looser. That's cool. And I would explain the why exactly what I just did. It's just new. Because almost without fail, the novelty wears off after a while, and those exact same drills don't feel the same. And that may take a few weeks, that may take longer or shorter, but at some point you adapt. You adapt to the sensation, the new sensation that's no longer novel. That's the trap I think we fall into with a lot of PT exercises that are low level. Like a glute bridge feels freaking fantastic on your back and your hips when you haven't done glute bridges for years. You get up and you're like, holy crap, I feel loose. Like that's the secret. That's the thing I haven't been doing. And then you do a few weeks of glute bridges and it's like, they don't feel like magic like they used to. You would have to do something to progress them, right? Progressive overload doesn't just go away. So then what do? You go on YouTube or Instagram to find the next new magic bullet, and now it's the sideline glute bridge, and that feels fucking fantastic for a few weeks until it doesn't. So I think that's a lot of kind of what we're looking at. Some of the exercises in PRI are a really nice entry point to get joints to move at ranges and positions that they weren't really accustomed to before. Functional range conditioning, FRC, is another proprietary system that it's just movement. At the end of the day, it's just branded movement, which is all good. But you're just moving joints at end ranges, and that's probably novel. And if somebody's, say, coming back from some type of hip surgery, like maybe an orthoscopic labral reconstruction or something like that, you may see me do an exercise that looks very much like a PRI or an FRC exercise because it's simply graded exposure to joint ranges of motion that I'm trying to get them more tolerant to. Internal, external rotation with various combinations of hip flexion, hip extension. But it just doesn't, the narrative doesn't go much deeper than that.
Got it. All right, Dr. Henoch, that's all I have for you for this episode. Fantastic insight. I think overall, this conversation will stir a lot of critical thinking within the listeners and just perhaps reflecting on some of these beliefs that have just been passed down within our industry for so long. And, maybe they don't completely buy everything that we're discussing here and they may not agree, but I think the goal will be achieved in that people will kind of think, are my beliefs actually correct, or is there a lot more to these ideas that we talked about?
Well, and that's an important point because I'm wrong, you're wrong, everybody's wrong. Like I think if we can all just come to that mutual agreement that we're all some degree of wrong and we're all just striving to be less wrong. We're never going to be right. Like we're never going to find the answer. Like that's not what science is about. Science isn't about finding truth. It's about getting closer to it. And it's an ongoing it's never going to stop. That process doesn't end as we learn more. So I think if we can just all agree on that, that's a great start.
Absolutely. I couldn't agree more. Dr. Henoch, for people who want to learn more about you and support you, where should they go?
Yeah, you can follow Clinical Athlete on Instagram, Facebook, YouTube, Twitter. Go on clinicalathlete.com and you can find the directory. So we have a free directory if you're an athlete and you're looking for a provider who's going to understand your goals and not just tell you to, find new hobbies. They're actually athletes themselves, Clinical Athlete. You go on clinicalathlete.com and the map is right there. You can find somebody in your area. And obviously with the current situation, a lot of things are moving to telehealth, but you can still contact the clinicians on the map because a lot of them have transitioned a lot of their services too remote. So you will be able to find an option and find somebody that you can trust. And then as for me personally, I have Instagram, Quinn.HennickDPT, and I'm on Facebook as well. So those are probably the best places.
And those will all be in the show notes for everyone who's interested. Thanks for listening, everyone. That does it for another episode of the Muscle Memoirs podcast. Until next time.